Well, I'm a general cardiologist, so I'm trained to treat all adult general cardiac conditions, a wide range of them. But my specialist area of interest and expertise is in implanting devices to manage cardiac rhythm disorders. And I implant several hundred of these to NHS patients and private patients each year. The cardiac rhythm is generated by a group of specialized cells within the right collecting chamber that generates a rhythm, and then that electrical impulse is transmitted by specialized conducting fibers that generates then a heartbeat. These can become damaged and patients often feel fatigued and breathless, feel dizzy or even black out because the heart rate is too slow or too irregular. So cardiac pacemakers are about the size of a wristwatch, which is implanted into the skin of your chest, and they're connected to one or two leads that go into the cardiac chambers, and this continuously monitors the heart rhythm. So if it becomes too slow, then it will generate an impulse that will keep the heart beating at a correct rate. And patients often feel instantly better when it's implanted, and generally can go back to their normal lifestyle and activity within days. Well, cardiac resynchronization therapy, or CRT for short, is a device-based treatment for heart failure that is highly effective. When the cardiac muscle is damaged in heart failure from whatever cause, often the fine meshwork of electrical fibers get damaged with it. These are called the Purkinje fibers, and the Purkinje fibers actually coordinates the contraction of the heart muscle so that it is done all together rather than separately. And what happens is that when these fibers are damaged, the heart contraction becomes incoordinated or desynchronous, very much like a team of rowers who are not rowing together. And this further weakens the heart and reduces its efficiency as a pump and exacerbates the symptoms of heart failure, such as fatigue and breathlessness. CRT works by restoring the normal coordinated contraction of the heart. In doing so, there's been several trials that have demonstrated that it can strengthen the heart, reverse some of the damage so that patients actually feel better and may also live longer as well. In order to do this, we would have to place a pacing lead inside one of the cardiac veins to reach the left wall of the pumping chamber of the heart, and this particular pacing lead will then take over the electrical conduction that would normally be delivered by the damaged Purkinje fibers, so that the left wall of the pumping chamber of the heart contracts earlier and in sync with the rest of the heart. There have been a lot of research into CRT. A number of large-scale trials have been performed involving thousands and thousands of patients, and it's clearly a very effective treatment. And it's estimated that around 70% of patients feel better and or live longer from having CRT treatment. Up to a third of patients don't respond to CRT. So the key thing here is to make sure that the right patients receive the therapy. So careful patient selection is important. The standard criteria for selecting patients is generally based on the ECG and the ejection fraction on an echocardiogram. But for my patients, I actually look at very detailed parameters on the echocardiogram, actually looking for evidence of mechanical incoordination of the heart using advanced echo techniques to confirm what you see on the ECG. Also, I often send patients for cardiac MRI because MRI is an excellent way at looking for scarring within the muscle tissue that can interfere with the resynchronization. The other thing that's key in improving the response rate to CRT is the recent advances in pacing lead technology, so that they're now more effective and they're easily deliverable due to the advances in the delivery kit that we now have. Some patients who have damaged hearts also develop very fast, abnormal, life-threatening rhythms that essentially stop the heart from beating. So defibrillators are implanted into these patients in the event that they develop these rhythms, and they are then have the capability of delivering internal shock to terminate these life-threatening rhythms and allow the normal rhythm to resume. Internal shocks feel like a very major jolt. I would say they're uncomfortable rather than painful. It's still a lot better than going into cardiac arrest. But modern day defibrillators now are much more reliant on very rapid pacing, which is also capable of terminating these abnormal rhythms, and therefore a lot of these shocks are avoided by the ability to rapidly pace the patient out of the abnormal rhythm instead. And if this was successful, then generally the patients would only feel a mild fluttering in their heart whilst the treatment is being delivered. I think these are very exciting times for a device specialist like me. We now have pacemakers that are completely leadless and can be implanted directly inside the heart and doesn't require any incisions at all, just a catheter inserted into the groin, and the whole pacemaker resides inside the heart. We also have cardiac rhythm monitoring devices that are tiny now, and that can be injected rather than inserted into the chest. And the other thing is that a lot of these new pacemakers and defibrillators are now wireless and utilize the wireless technology to allow remote monitoring of the patient's condition, so that they can be monitored at home or while on holiday, and any abnormalities or device malfunction can be alerted to the monitoring center without the patient having to come to the hospital cardiac department for frequent visits.